case of COVID-19 disease reported for Mobile County was the 19th of March. And we will hit the 1-month anniversary of that terrible news this weekend. So I just wanted to make note of that. We know everyone is still working very hard to protect themselves and their families, and our healthcare providers out there are trying to keep you well and cared for. We've got, essential businesses that are still open and people staffing grocery stores and putting things on shelves so that we can have the food and the medical supplies that we need and the gas that we need. So thank you all of those, everyone who's been deemed essential to make sure that we have the power and the gas and the groceries that we need to comply with the state health orders to stay home and be in quarantine and isolation to keep ourselves well. So as usual, I'll talk a little bit about the numbers. 2.1, almost 2.2 million cases of COVID disease confirmed worldwide, with nearly 150,000 deaths. In Alabama this morning, the live dashboard was reporting just over 4,400 cases in Alabama, with 137 reported deaths. 82 of those died from illness. And in Mobile County this morning, the live dashboard was reporting 594 cases of COVID-19 disease in Mobile residents, with 23 deaths and 12 died from illness. So I've been saying that there's going to be a change in the way we report deaths from COVID probably over the weekend, so that we are just reporting one number of death related to COVID instead of two, to make it a little bit more confusing. But I also want to just provide an update on some anecdotal information that we're hearing from our hospitals. I have said that there is a delay in receiving reports of death, and that is true. We don't know how long that delay is. We don't know how many days or weeks that delay is. But in talking with some of our local hospitals, they are concerned that we may be underreporting the number of deaths. And we're going to be looking at that more closely this weekend to see if we can find out more information about the delays in reporting deaths and how we can get the most current information that we have. So I just say that to remind you that I've been saying that the death rate right now is around 2.5%, and that is, fairly normal for what we've seen around the U.S. But I just want to caution you to continue to take seriously the severe complications from COVID-19 disease, including hospitalizations and deaths. Our deaths have been among the people who are older and have underlying medical conditions. So if you are in those age groups and in the category of having an underlying medical condition that might cause you to have more severe complications should you get infected with COVID, please stay at home. Only go out for essential needs or medical appointments. Have a family member go to the grocery store for you or go to the pharmacy for you, because we want to protect you the best that we can. So today our health officer, Dr. Eishold, commented that it's beautiful weather. I encourage exercise with social distancing at 6 feet when walking and 15 feet when running or biking. So this was referenced in the New York Times article that's called "For Runners, is 15 feet the new 6 feet for social distancing?" So based on some information that when you are exercising vigorously and panting, that you may, and moving more quickly through airspace and proximity of people, you may need to keep a greater distance. So thank you, Dr. Eishold, for reminding us about that. So I'm not going to go into a lot of the details about our data today. Again, just to remind you that we do expect that the number of deaths is going to jump up perhaps over the weekend, and we'll talk more with you about that next week. Of the 16 deaths that we had confirmed from COVID illness, again, between the ages of 52 and 83, 12 male, 6 female, 10 African Americans, and 6 white. And as I'd mentioned before, with underlying health conditions that made them vulnerable to this new coronavirus. All right, so here are some questions that we've queued here. and I'll answer these to the best of my ability. Let's see. This is not a question, this is an announcement. Our public information officer let everyone know today that because of the confirmed cases of COVID-19 in Alabama, the Mobile County Health Department had made temporary changes to its healthcare division, Family Health. But one location will be coming back online next week, so we're really excited about this. Family Health, the primary care division of the Mobile County Health Department, will resume modified operations on Monday, April 20th at the 8 Mile Health Center. That's on 4009 St. Stephen's Road. The site will open Mondays and Thursdays from 7:30 to 4:30 p.m. for well children aged 1 year to less, from 1 year old to less than 5 years old. So again, we already have a well baby clinic for 1 year and less. So this is opening up for well children ages 1 year old to less than 5. So we're excited to be able to open up some additional services for the health department. Here's a question, it looks like from Fox. Can Dr. Murphy update us on the mobile healthcare facilities? What are the current and projected capacity of hospital beds and ventilators? So I took a quick look at that this afternoon before joining you here on live Facebook. And I can say that right now we have, our mobile area hospitals have plenty of empty beds. They have plenty of ICU beds and plenty of ventilators. So we currently do not have a shortage of any of those medical facilities, beds, ICU beds, or ventilators. Some of the hospitals are reporting, as have been throughout the outbreak, critical shortages of personal protective equipment, things like face masks, N95s, gloves, gowns, bouffant hair covers or booties, and also a critical shortage of sanitizers or wipes. So those critical shortages are why we still have to keep health care in our minds of, not to overstretch the healthcare system, because they don't have the personal protective equipment and the safety disinfectants and other safety precautions that they need to go full force right now. So we're just trying to make sure we don't overwhelm the hospitals so that they can care for our most needy patients. And when you look at the model that says, again, that we should be peaking, Alabama should peak on the 21st with regard to the amount of resources that are needed for our cases, we still are well below the capacity in Mobile County. So according to that model, if we do reach our peak next week as expected, that we should still have enough beds, ICU beds, and ventilators for the people who will need them in Mobile County. And that is a credit to the public health measures that have been put into place, closing schools, closing non-essential businesses, and ordering stay-at-home. And those models are looking much better. Again, that we know that they're not 100%. There's a wide range of accuracy, but just like we rely on modeling to predict the storm of a hurricane, we are taking this information and using it to guide some of our discussions. So here is a note to me. I found out from one of my employees today that her daughter Taylor is a big fan of Facebook Live and the daily update, so I just wanted to say hi to Taylor. Thank you for your support. Here's another message from the Mobile County Health Department, and this again is something that we're really excited to announce. So Family Health, again, the primary care division of the Mobile County Health Department, is expanding its ability to test for the COVID-19 coronavirus at the Keeler Memorial Building located at downtown Mobile, 251 North Bayou Street. That's where we're broadcasting from today. Here's the quote from our health officer. Well, that's actually from Kelly. We now have COVID-19 testing for symptomatic patients, regardless of whether they are an established family health patient or not, at our drive-in site at Keeler. So this is from Kelly Warren, Executive Director of the Family Health. That's the primary care division of Mobile County Health Department. She went on to say the patients can be seen by appointment only, Monday through Friday, from 9 a.m. to 3:30 p.m. Patients will be seen in their cars in a drive-in type situation. To receive an appointment, the public should call 251-410-MCHD, or that's 251-410-6243. When someone at Mobile County answers the phone, they'll determine if you're eligible. Do you have fever, cough, shortness of breath? Are you a healthcare worker? Or do you have an immunosuppressive condition? That sort of thing. But once you go through those screening questions, then you'll be able to make an appointment, whether you are an existing patient of ours or not. So please give that number a call. There's no cost for testing. That's not on here, but I think that's right. So keep my fingers crossed that's the right answer. Right, Matthew? Okay. So also, here's a media question. Does the Mobile County Health Department have any comment on Will Ainsworth's committee's recommendations on small businesses? So some of you may have noticed that our Lieutenant Governor and the Legislative Task Force on Small Business Reopening issued their guidance, I believe yesterday, maybe first thing this morning. I've not read it through, and I'm not the point person on planning for reopening. That's my colleague Pebbles King, who I think may be joining us on Monday to answer your questions. So stay tuned on that. A lot of discussion about what it looks like to reopen after the outbreak is over, and we've not even hit halfway yet. So yes, we need to be planning for those things, but as I said before, it likely will be a slow, phased lifting of isolation and movement and restrictions and gathering restrictions, not just sort of turn the button and everybody goes back to what they were doing. I also want to make sure that you know, particularly if you're a healthcare worker, that CDC updated guidance for return to work for healthcare personnel with confirmed or suspected COVID. This was just updated a couple of weeks ago, I think maybe Monday or Tuesday, and it's very important. The changes include a preference for the test-based strategy to determine when healthcare personnel may return to work in a healthcare setting. And it also adds return to work criteria for healthcare personnel with laboratory confirmed COVID-19, but who have had no symptoms. So if you were a healthcare worker and you had a positive test, and you want to return to work, it provides the guidance for doing so. And there's another comment that this aligns with recommendations for universal source control for everyone in a healthcare facility during the pandemic. So I will go into more detail about that, but if you work at a healthcare facility, a nursing home, a long-term care facility, or if you are in a pharmacy or a community clinic, any healthcare personnel, the guidance has been updated and you can get that on the CDC website. So Matthew, any questions?
None.
Okay, great. So we have two other colleagues here from Mobile County who have important information to share with you today, and I will turn it over to Amanda Arnold.
Good afternoon. I hope y'all are enjoying that nice weather. I hope it stays around a little for the weekend so I can enjoy it too. Just wanted to give you a quick update. I'm the director of the WIC program here in Mobile County, and we have been working doing remote phone certification, and we appreciate everybody who has called in and received their benefits. Just a few reminders that we do have an email address that you can send the proofs of your residency and your ID and income to us. The staff is requesting that you do that the day of if your appointment's in the afternoon, or the day before if it's in the morning, because we're getting a lot of emails and sometimes it's hard to find your information and you may have to resend it. So we're just trying to keep you from doing that. That email address, if you don't have it, is wicmchd@mchd.org. So that's wicmchd@mchd.org. So thank y'all for doing that. I'm trying to think about, the other, and if you do have a scheduled appointment or you need an appointment, just call your clinic number and someone will pick up and schedule that for you. Be patient with us as we work through all this, because we've got a plan now and it's working, but it is taking a little longer than sometimes we suspect, and so just be patient with us. So if you don't get us the first time, just keep trying. Make sure you set aside a good 45 minutes to talk with us if it's a certification appointment. And the last thing I wanted to touch on is if there is anybody out there who who has been laid off or is now unemployed because of this pandemic, the WIC program is here for you. Our income guidelines have not changed, but the way we assess those have been updated to reflect this this event. So if you are one of the unfortunate people who have been laid off or are now unemployed, maybe the WIC program can be a little less stress, take some stress off of you and your family. If you have any questions about your income levels and if you would qualify, if you will give us a call at 251-690-8829. So thank y'all so much for being patient with us and working with us. And then I'd like to now introduce Virginia Gordon. She's going to give us some pointers and tips, and she's always a pleasure. Y'all enjoy.
Thank you, Amanda. My name is Virginia Gordon, and I am the Behavioral Health Administrator here at the Health Department, and also a licensed professional counselor providing telehealth at this time for children, adolescents, and adults. Right now, a lot of people are struggling with significant emotional distress, not only in the form of depression and anxiety, but also in the form of chronic stress, which I really want to talk about today. I understand that some of the tips that I pointed out the other day were sounding elementary, but in reality, many intelligent adults forget to fulfill their basic needs in a time of crisis. Yes, these needs are simple, including drinking water through the day, getting enough sleep, and asking for help. But because during a significant amount of distress, many people do forget to say that, I wanted to highlight awareness of it for us all. What our team of counselors do here at the Health Department is work alongside primary care providers, having a unified mission surrounding holistic health. That physical health is directly connected to mental and emotional health. That is why we provide wraparound services, which is inclusive of but not limited to nutrition and behavioral health. As opposed to acute stress, which is more short-term, chronic stress has a significant impact on the body because it creates pressure on the body for an extended period of time. Having chronic stress feels like being in a constant state of heightened alertness, often accompanied with a significant amount of anxiety. Signs often include irritability, fatigue, headaches, difficulty concentrating, feeling helpless, low self-esteem, among others. Unregulated chronic stress can contribute to a range of physical and mental health disorders. Managing the stress can be a challenge since it can seem overwhelming with people unable to feel control over their life. Simple but powerful ways include recognizing the signs of chronic stress, gaining emotional support from friends and family, exercising regularly as recommended by your doctor, mindfulness or prayer, and improving your sleep quality. For further individual support through behavioral health counseling, which is free of charge at this time, you can call the medical triage line at 251-690-8978. I will leave you with a small tip to show kindness during this time. Many research studies have shown and been published revealing that kindness can decrease stress, anxiety, depression, blood pressure, and even pain as it produces endorphins, which is essentially your brain's painkiller. If you find yourself limited to show kindness, feeling easily agitated and negative most of the time, this is a sign that you could benefit from seeking support and finding healthy ways to relieve your symptoms of distress. Ways that work for the long term and improve your well-being. Doctors and mental health professionals around the country are encouraging peer-to-peer support at this time. A new thought to consider is that social distancing phrase really means physical distancing, since we need social connection more than ever right now. Thank you for your time, and I hope that this brief segment was helpful.
All right, thanks everyone. We'll be back Monday at 2:30 with another Facebook Live update. And again, thanks to everyone out there who's, fighting the hard fight and doing the things that you need to do to protect our community. We'll see you on Monday.
Welcome to Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Dr. Randy Murphy with the Mobile County Health Department. She says that local hospitals are concerned that they are underreporting the amount of deaths. Mobile County Health Department is looking into that this weekend. Now, Dr. Eichhold said that 15 feet apart is the correct amount of social distance for runners and bikers who are exercising, so keep that in mind this weekend. Dr. Murphy explained that the Mobile area hospitals have plenty of beds, ICU beds, and ventilators at the moment. She says the peak is near April 21st, and we are still well below capacity here in Mobile. Now, we are expecting to hear from Mayor Sandy Stimpson around 3 p.m. today. You can find both of these news conferences on our YouTube channel and Facebook page. I'm Chelsea Sayasan. We'll see you soon.